Good afternoon, Victoria. As you may know, President Trump addressed the nation yesterday afternoon regarding a three-phase plan for states to reopen under certain conditions. Today, Texas Governor Abbott followed suit and announced a strike force and a plan to align with President Trump's. Our Victoria mayor and judge both are on a conference call at this moment with the Texas governor as I speak to ensure that Victoria has an adequate plan to reopen our local economy. The mayor and the judge will address this very topic on Monday, which is our next press briefing. Now I'd like to provide you information about the status of COVID-19 in our community. As of 2:30 p.m. today, we still have 0 new cases. Total cases in Victoria County is 89. Suspected community transmission is at 20. Recovered, 54. Active, 34. 11 are hospitalized, 3 of which are in the ICU. Today we will have our Public Health Authority, Dr. John Mcneil, and our Public Health Department Director, David Gonzales, who will discuss COVID-19 in Victoria County, including our testing data and capacity, CDC recommendations on how businesses can properly disinfect various types of surfaces and items prior to reopening, whenever that may be. For local information directly from us, you can visit victoriatxoem.org or call our hotline at 361-580-5796. At this time, I will turn it over to Dr. John Mcneil.
Good afternoon. Thank you, Ashley. First off, I want to reiterate for the people that are just joining in that we have 0 new cases today. So we're not reporting any new cases of the COVID virus in our region today, but we still, I say this every time, we're still getting data in all day long, so there's still the possibility of cases becoming reported to us today. That will be given to you later if that happens. We're still at 89 cases, and that number has remained pretty stable. Our suspected community transmission is at 22.5%. So of those patients, remember, those are ones that we think were transmitted throughout the community, and that's a number that we watch very closely in public health. I'm glad to report that we actually are up to 54 patients now that have recovered from the virus. That's a wonderful thing. That's the number we want to see increase every day. So when you do the math, that means that 60% of the people that we've listed here with the disease have already recovered. That's a wonderful number. That's the kind of number we want to see continue to increase as well. We still have 34 cases that are active that we're following very closely. The epidemiology people meet with these people, or they talk to them on the phone. We monitor their symptoms. They're still very active, and the health department is following them closely. Concerning the post-acute medical outbreak, that included 35 Victoria County residents, 30 of which are healthcare workers and 5 are patients. I'm happy to report that 17 of those patients are now listed as recovered by Centers for Disease Control standards. I just have a few things I want to say, and then David will speak, and then we'll answer some questions. Our numbers are down, and our numbers of new cases are down, and they're hopefully trending down, and that's going to have to be followed. I just want everybody to say this, and I use the word vigilant in every press conference that we do, and I say that because we've got to remain vigilant, and we've got to keep doing what we're doing. Our numbers are down because we've done what we need to do. We're doing social distancing, we're wearing masks, we're staying at home whenever possible. We're all very aware that COVID is out there, and that's the reason we're doing well. I really believe, as does every other expert in this world, that if we let our guard down, these numbers will come back up. So this is not the time to take your foot off the gas pedal, as far as, I think that's what Dr. Fauci said, so it certainly must be right. So keep doing what you're doing, and hopefully we'll see these numbers continue to improve. Now, along with this improvement comes the next step, and the next step, of course, is recovery, and the next step is how we're going to get this country back to work and how we're going to get people back to whatever the new normal is going to be. That's very important to us, and we're working on a phased plan. I have a list of things that David and I and everybody else that's helping make these decisions have looked at, and this phase plan is going to start off hopefully soon. We're going to get the recommendations from the governor, and as Ashley just told you, right now they're on a conference call, and the governor is speaking to all the mayors and county judges in the state. So hopefully we'll have better information as to how that's going to happen. Right now, I can tell you that it will be a phased plan. It's something that we will work in. When you think about this, we phased our way into this. We increased our vigilance. We increased our restrictions. We increased everything that we needed to do in a phased manner. We're going to go out the same way we went in, okay? So give us time. We'll have that information for you, and I think, Ashley, it'll be Monday. We'll have a lot more data on that.
That's correct.
So we'll be churning up numbers and looking at a lot of stuff all weekend so that we can come up, hopefully, with a plan that does the hard thing. And the hard thing is mixing the economic needs of the community and the economic needs of our state and our country with the public health needs of our state and our country, and especially our community. So remember that this is a community disease, and this is a disease that this war will be won or lost at the community level, and we've got to be very vigilant. And we're going to be very vigilant in our community, and the recommendations that we make will be right along with what the governor has said and what the Centers for Disease Control has recommended. So hopefully we'll have a lot more information for that very soon. Excuse me. I want to talk about testing because we always get a lot of questions about testing and what are we doing. There's some interesting things about testing because testing is an ever-changing thing right now. So there are a lot of new test sites that are available, that are coming available. We have new testing sites in Victoria. So this morning in our meetings, we spoke of compiling a list. We're going to work on a list, and we're going to get a list of every testing site in Victoria, and we're going to put that on Facebook or our website, wherever Ashley says to put it. We're going to put that out there for everyone to see. Now, when we talk about this, we've talked about the availability of testing. I can tell you right now, and I'm happy to say this, and I'm kind of surprised that I am saying it, but we have testing available in Victoria. In fact, right now we have a lot of testing available. In fact, right now we probably have more testing than we need actually for sick individuals. And that's a wonderful thing because a couple of weeks ago when I was talking to you, I was saying there are people we can't test because we don't have the equipment to do it. Well, that's not the case now. We do have testing available, and that information will be made available to everybody. But remember, we're still not at the point where we can test everyone. We're not going to test the entire country and tell everybody they can go back to work tomorrow because they're COVID negative. I wish we could, but we just don't have that capability. That's millions and millions. We've done probably, I think I saw that we've done maybe 3 million tests, which is 1% of the country. So we still have a lot to go in that regard. But I can tell you, and I can say this to you right now, the bottom line is in Victoria, Texas, right now, if you're sick and you have symptoms that may be COVID, we can get you tested. So that's very important. Let's see. Now, also today, I want to just mention just a few things for you because we're kind of starting the mode where we're starting to think about transitioning back into getting our community back to where it was or to whatever the new normal is going to be. So one of the things that's going to come up is that we're going to have to be prepared for this, and one of the things that we really want to talk about is cleaning. Now, I never thought that I'd be up here telling you how to clean your countertops, but I'm about to do it. So I'm going to do it based on the CDC standards, and I can tell you this, that the Centers for Disease Control has these little handouts now, and these are going to be on our website.
Correct, and at cdc.gov.
And at cdc.gov, and it even says /coronavirus on there. So y'all can go there and you can get these things. And what this stuff is, it's actually very interesting. It talks about looking at what they call high-touch surfaces. They talk about different ways to clean it. One of the most important things is what do you clean it with? There are a lot of commercial things out there. Lysol makes some good brands that kill 99.9% of everything. There's also Clorox brands. You can make your own solution out of bleach. And I'm going to tell you the little formula right here because the CDC told us. It's 5 teaspoons or 1/3 of a cup per gallon of water. So you can do that, and you can put that in your gallon of water and use that to actually wipe down surfaces. One thing I will tell you, and this is all over the CDC website, is that when you do wipe something down, you got to let it dry. You can't dry it yourself. The drying time is the killing time, okay? So we're trying to get rid of this virus and be able to kill it. Remember that this is mainly spread through droplet theory. So in other words, we cough, and that's why we're wearing masks. So when we cough, we don't spread this. The other thing is that it also is possible to pick this up when you pick it up with your hands and you touch one of your mucous membranes. You touch your mouth or your nose. So we're very careful about that. Wipe off doorknobs. They list of the high touch areas. Your telephone. I've seen some terrible things about the bacteria and viruses that can grow in telephones, and you keep those right next to your face. So make sure you wipe your phone down regularly. Countertops, door handles, desks, faucets, sinks. Things like this, things what we call high-touch areas. So be very vigilant about that. Keep your house clean. I use those little Lysol wipes at home, and they work really well. Just let it dry. They talk about cleaning house, other soft surfaces and stuff. You know, the commercial carpet cleaners are well for your carpet. You just got to keep your house cleaner than normal right now because you don't want the virus there. Electronics, as far as your computer, think about your keypad. You know, we're saying don't touch your face, but then we've got our fingers all over the keypad all day long. So wipe down your keypad. Doing laundry. They talk about doing laundry. Warm water will kill this. They even say that if you have someone that's possibly exposed, say if you have a sick person in the house, you can wash the laundry with their laundry because the laundry will kill it. The water and the soap in the water in the laundry will kill it. So make sure you do that. They even tell you not to shake the clothes. You know, a lot of times we shake the clothes before we put them in there. At least I do in the limited amount of clothes washing that I do. But just don't shake it because then if there is virus on it, you're going to expose that and put it into the environment, okay? So be very careful about that. If you have someone sick in the house, we've talked about this before, that person can be kept there safely. Try and let them use their own bathroom if possible. Try and keep them isolated from others, certainly. Wear a mask when you're around them and have them wear a mask as well, too. Don't think they're just coming to dinner with everybody. We've seen cases transmitted here in Victoria, and we've tracked it back to where they had lunch with someone that was COVID positive back when they're doing the contact tracing because you take your mask off to eat. So be careful about that too. There's also a bunch of information on cleaning specific facilities, and if you own a business or you work at a facility, there's specific instructions on that. I would encourage everybody to go to cdc.gov/coronavirus, and that should give you all that information. I'll be available for questions in a few minutes, and Ashley?
Thank you, Dr. McNeill. I'm looking at the CDC printout that is available online, and it also addresses additional considerations for employers. So encouraging to educate your workers on how to properly come back to the facility once it does reopen, and how to remain, like Dr. McNeill said, vigilant about how to address your personal safety and health so that you can protect others around you. Also, as a reminder, I want to remind you guys that we will hear more about the plan as far as reopening Victoria directly from our mayor and our judge on Monday. So at this moment, we'll hear from our Public Health Department Director, David Gonzales, and he's going to talk to us more about local data, including the testing capacity and regional hospital counts.
Great. Thank you, Ashley. So one thing I just want to clarify is just due to the closing of the specimen collection site that we had in the community center parking lot, that doesn't really impact the total testing capability across the county and the region. Like Dr. McNeill alluded to, we still have the ability to test locally. There's still plenty of tests available. I was contacting labs earlier. They said there are collection kits available to run those tests, so we still have that capability, and in no way does the closing of that site directly reflect that we lost that ability, just to clarify that. We still have that ability in physicians, urgent care clinics, and hospitals. They can still collect those samples and process those labs. Did want to do a quick update on our total lab counts. As of today, testing capability in the county has been at 1,080 tests conducted. We've done about 30 the past 2 days, and there's about 30 of those pending. So if you recall back, I think the mayor may have briefed on Wednesday that total count, or the judge, I can't recall, was about 1,050. So again, 30 seems maybe a little low, but I think that's a good thing. I think it's more indicative of the situation we're at as far as there's just not the need at this point. I think the social distancing and protective measures have been put in place, have been effective, and I think that's really a clear indicator on these the lack or the low test numbers these past few days. So hopefully that trend continues and there's not a need more so, and that's why we have the low test numbers. One thing to keep in mind that I know Mayor had addressed on Wednesday as well is our total, I guess, testing rate or per capita of tests that we've conducted here in the county versus what they've done across the state. Right now, we're right about double that. We're sitting at about 1.2% of the population that have been tested here in Victoria County versus state average is sitting at about 0.6%, maybe a little lower than that, but just roughly as of this morning. You know, like I mentioned earlier, these numbers are encouraging. You know, low test numbers don't necessarily reflect that we can't do the test. It's a matter of the need's not there. And we identified there's plenty of testing available actually within the past 30 minutes or so with labs and an urgent care clinic to make sure they have the ability and tests available. And they stated they have plenty available So again, I think that's a good indicator and a positive a message that's being put out there. Moving on to information releases. I know the public has asked, and I think some media partners as well have asked as far as reporting out specific information on some of the patients. Keep in mind, we just want to remind everybody about the privacy rights of those patients. They're still patients just like any other disease that we deal with, and as in the public health department, we deal with communicable diseases and reportable diseases on a regular basis. So keep in mind that this still applies, those HIPAA rules still apply to that. So we're always going to err on the side of caution when we're releasing information to protect that patient privacy first and foremost. One thing, some questions have come up is regarding, I need to know who it is so I know if I had contact with them. Well, what we do on the epidemiological investigations and the contact tracing, we do reach out to those high-risk contacts. They are contacted directly once they're identified from those positive cases, and then we'll be reaching out to them on a regular basis hours after that case is initially identified. So that's where those initial contacts will be made, and if you are high risk, you will be contacted directly. And as we go down the risk level, we stated before, once it's more of a community risk in a location, then we'll definitely notify the public through that, through our press releases, through our public information officers, and we can issue those out at that time to advise you on that. There are also a few questions I wanted to point out real quick regarding the gentleman who passed away that was a Victoria County resident. Keep in mind the details behind that were he was at a facility outside, acute care facility outside Victoria for a long period of time, so most likely, or he did acquire the case outside Victoria County. However, we do those reporting of deaths for Victoria County residents regardless of where they're at that time. So the same will bode true for if we possibly, heaven forbid, if we have a death here in a facility that's not a Victoria County resident, we will not be reporting that because they're not one of our residents. That county, whoever their county of residence, will be reporting out on that. And that's, again, standard across the board with public health, what we do on a daily basis. One last thing I wanted to touch on is some regional hospital data. And if you recall in the initial conversations, we had addressed how we're going to be looking at this as a whole, the impacts both of the community and the healthcare system, that we're going to be really looking at a regional perspective. So right now, I just want to throw a few numbers, not too many of them at you. What we're looking in what we call Trauma Service Area S, and that is Victoria and the contiguous counties and the hospitals that are actually based in those counties. As of noon today, there was 293 available hospital beds in the region. There are 37 available ICU beds, and there's 50 available ventilators. And that is going to be Victoria, Jackson, Calhoun, DeWitt, and Lavaca County hospitals in Victoria. So that is the kind of current regional situation, which is encouraging. You see the ability there. Much unlike the cases in New York and the situation they were in where they have really limited availability, it's encouraging news that we have those resources available to us at this time. And with that, I think that's all I had, and I'll allow Ashley to open up for Q&A.
Sure. Thank you, David.
Mm-hmm.
Positive news, hearing about increasing testing capacity in Victoria County. I think that number once again was 293 beds available in the hospital region. And that region once again was Victoria, Jackson, Calhoun, DeWitt, and Lavaca. Is that right, David?
Yes, that's correct.
Okay. I just wanted to reiterate that good point. At this time, we will open it up for any questions.
Yes. Why has Victoria County had more testing than the state average? And yeah.
Yeah, I'll take it. Yeah, and I think part of that was due to the outbreak. We definitely focused on that facility and really pushed a lot of tests to those folks, and we reached out and had a lot of great partners, private and public, to coordinate the testing of those individuals so that we really could limit the exposures there and identify as many cases as possible within that facility to really hinder the spread, if you will, of that disease there, both in the facility and then in the community. So that was definitely, but again, we've made it available. I think the specimen collection site, I think was a great success. We had the plenty of tests available there. And again, the private physicians and urgent care clinics have been great. They've done a great job of getting as many tests as they can ordered and available to our community. So I think it's a reflection partly due to the threat of the outbreak itself, but then also just availability in the community as a whole.
And I guess follow-up question on that. What is the role of testing going to be as we move toward reopening our economy and deciding how we're going to do that?
Sure, and I think the important thing is having that available at all times and having that capacity and the capability to test continue as it is now. That way, if we do, perhaps if there's a negative result of opening up the economy, I guess you have those availability to test if you have symptomatic individuals come up. Because if you do that, if you open up an economy in a community and you don't have the availability to test, then it's going to be difficult to identify at what stage is the transmission rate with this virus, and I think that's a good indicator. I don't know if Dr. McNeill going to add anything to that.
Only thing, that's exactly right. The only thing I would add to that would be that's actually one of the requirements for moving forward with your phases, is that you have adequate testing, because the last thing that we want to see happen by trying to open up the community is to have a significant spike in the number of cases. And if you don't have the testing available, then you're not going to know those cases are there, and your whole concept is going to be thwarted.
Sure.
What are some of the contributing factors to Texas being the second state in the United States to have the most recoveries, in your opinion?
Well, in my opinion, and this is strictly my opinion, we were able to see what was going on in other places. And I think we were very proactive. I know we were proactive in Victoria. And really what we did pretty much mirrored a lot of the other places in the state. So I think that we had the benefit of seeing what could happen. And I think that maybe we were just a little bit scared that could happen here. So I think that we aggressively went after this disease and did the best that we could. I think that when we look back at this one day, we'll find that we down here in Texas, we were probably a little bit ahead of the game, and unfortunately because others weren't. So, and not by any fault of their own, but just by the fact that that's where it started, and it seemed to move down here. So we just did everything we could, and it's too early to say for sure, but it looks like maybe our efforts have helped, or they certainly have helped. It just looks like we're just hopeful that it maintains that. David, do you have anything else?
No, that's great. No, thanks.
Any other questions?
Yes. Any idea about how many clinics, offices in Victoria County are currently providing testing? And do we have any plans to resume operations at the public sample collection site?
I think that actually the question was how many facilities. When we talked this morning, we all told each other of other clinics that we had heard that are going to be doing the testing. So we're trying to clarify that, and that's one of the reasons that we're going to compile that list, and so that everybody will have the availability to get tested.
Yeah.
Another question. According to the state health department, Victoria County ranks near the top in Texas with per capita infections. Is that a cause for concern to you? How much concern? And yeah.
I think there's going to be two parts to that. One is, yeah, we do rank at the top. If we do, I don't know the exact stat you're referring to, but keep in mind, I think we're at the top also in the amount of tests we've done. So I think those are indicators of each other. And of course, obviously with the situation of an outbreak, that really increases your number via so many cases in a confined area. So that's really going to jump up your per capita rate of infections. But then again, with the testing also, that I know Dr. McNeill says it'll steal a line from him. If you're not looking for it, you're not going to find it. And I think we were really looking for it, so we did find a lot that may have not been otherwise discovered with some of those individuals that may not be showing as severe signs and symptoms that may have not normally gone to get tested. And during the outbreak, since we did focus in that area, they did get tested, and we did discover that illness there.
That higher rate that we just talked about, do you think that might indicate a more conservative approach to reopening the local economy here?
Honestly, I don't think so, because as far as, are you saying conservative on which side of it?
I mean, I guess more restrictive, more cautious reopening of our economy.
And I think that's what our judge and our mayor are
Yeah.
evaluating in their call with Governor Abbott right now as we speak. So that's a very good question that we can certainly address on Monday's press briefing.
And I will add that every community is different, so our numbers will be looked at specifically for our community, and that's been one thing that's been pretty consistent with the federal government saying that it's up to the states to do what they need to do, and the states saying it's pretty much up to the communities to do what they need to do, because they understand that this is a community disease. So our community, regardless of what the numbers were, that's what we'll base our decisions on.
And one more thing, John, just keep in mind if we look back, I guess maybe about 3 weeks ago, when we started looking at the current situation and where we're at, I think the judge and mayor and the policy group and command staff and obviously medical advisement was really ahead of the game. And I think putting our restriction in place, looking at the bell curve, the plan that we had in place, the strategic plan, seem to be always a phase ahead of the situation. So I think we're very proactive in those restrictions and the social distancing guidelines and the personal protective measures. So I think definitely we did a great job there in being proactive in that to prevent further transmission.
Speaking of county leaders, previously our county judge, Judge Zeller, said that you're more likely to die driving down North Navarro Street or almost anything else in comparison to COVID-19. What significance do you think our community members should take from that statement? And do you think that's a wise statement to make at this point with public health?
That's a good question. And we can't speak for Judge Zeller. Again, he'll be here Monday, so he can certainly answer that question. But he's speaking in terms of how it relates to the statistics and the amount of deaths and comparatively how many others could result from other types of deaths that happen every day. Yes, ma'am.
Is there a distinction between PAM and post-acute medical and post-acute specialty hospital?
That's good.
I'm sorry, and that's on. We'll take all the blame for that one. We're bad about using acronyms. So now there's post-acute medical north is the facility that was directly affected. They do have other facilities here locally, but that is the one facility that was affected from the outbreak. So I apologize on that behalf for using acronyms.
So is there a post-acute medical south?
Yes.
Okay, I see.
Yes, and there's another too.
At East or something.
Yeah.
I know there's one at Detour, there's one at Citizens, and there's one out north. So, and I think there's another one. So, but
Sure.
oh no. But when we say PAM, we mean post-acute medical, and when we're talking about the outbreak, it was limited to that one facility, and
Which
that's
was
what
PAM North.
Which was PAM
Right,
North.
good
Mhm.
question.
Now, I still
I'm
call
glad
it
you
Warm
asked that.
Springs, so I'm surprised I haven't said that because it's the old Warm Springs. So.
My last question is philosophical in nature, and feel free to, but you have to promise that you'll answer it before this is all said and done.
Wow.
Which is, what have we learned? What have you learned as individuals?
Wow.
That's a very good question. Well, I think we're all in this together, right? And so we learn a lot from each other. We learn a lot in terms of how we respond during tough situations. We learn a lot about how vital information is, which is why you all are here today and why you all are listening. And we learn a lot about public health, right? We do have emergency operations, which includes training that we do daily, monthly, consistently for different scenarios, such as a public health crisis. And so I would say we're learning just as much as you guys in terms of coronavirus, but we're fully prepared and we're responding just as much as any other county would be. Did anyone else want to add to that?
That's why Ashley is the public information officer. No, I think I agree with that. We've learned a lot about this kind of thing. You know, this is unprecedented, you know, and there are people that I've never heard of Dr. Fauci before, but now he's, you know, in my living room every night. So it's a different world. I think the biggest thing to me is my curiosity as to what our nation and what our state and our community is going to be like after this is over. So that to me is the most interesting part.
And that is a part I'm waiting to learn as far as how this event itself kind of affects society as a whole and how we go about daily life and how that changes. You know, myself coming from public health and then also with emergency management, this is the one scenario that always kind of worried the emergency management field. We can handle hurricanes, we can handle floods, we're good at that, we know that. But pandemics is something that nobody really can say they're truly prepared for. So we're learning day by day, you know, so many new things. You know, I'm personally obviously exposed to the laboratory world, that's all new. You know, it's not really something public health daily operations, but I hope it really awakens everybody to realize the importance of, you know, public health, obviously, and the effects on a daily life that it has. We usually working behind the scenes. I think this is one of the first times we've been brought up to the forefront, but, you know, this is basically something we do on a daily basis, but just on a much, much larger scale. So just want to keep in mind the importance of, you know, just these general hygiene procedures going forward and how things like that have an effect on an event such as this.
We have time for maybe one more question.
Real quick, basic question. Where are we in our community spread level? Is it still moderate? And yeah, I guess that.
Yeah, we kind of
We're
discussed
talking
that
about
this morning.
yeah, go
And
ahead.
I think that if the numbers continue, I think that that could be downgraded a little bit. That will be up to the epidemiology people, because it's not necessarily just the number of cases, it's how those cases got there. I mean, I've always said this before, if you have 10 cases and you know exactly where they came from, that's one thing. If you have 5 cases and we have no idea where they got them, that's a completely different thing, because that's more community transmission. So right now, I think our community transmission, I told y'all, is at 22.5%. And if that number stays stable, then I think that hopefully we'll be able to drop that down to a milder version of transmission.
And second part to my initial question, do you think we've reached our peak yet in our curve?
I hope we have, and one thing we are watching for obviously is the results of Easter,
Yes.
and that's for us. That's what we talk about daily, hourly.
That's-
Really, what's going to come up in the next 5 days? Because you have that incubation period of the disease itself, you've got the onset of symptoms, and then you've got the testing, and then the few day delay to get those test results back. So we're guessing 10 to 14 days from Easter to where we really see a possible increase due to those large scale gatherings. We know they happen, even though they weren't supposed to, and we're well aware they happen. So we're hoping it doesn't have it. We don't have another spike. We're anticipating it and we're ready for it. If it doesn't happen, then great. Then we're over prepared, but I'm happy to do that. So that's one thing. I hope once we get through these next few days, then we'll definitely see a continued downturn at that point.
And we'll be able to answer that, your first question, a lot better as far as community transmission levels. So we're just a little gun shy right now as
Yeah.
far as waiting for the other data to come in.
Yeah, hopefully next week we'll have a really good idea.
Yeah, that's the-
Well, I will remind you guys that I will be available after this briefing for additional questions, and so at this time, we'll go ahead and wrap it up. Thank you, Dr. McNeil and David, for your
Thank you,
relevant
Ashley.
updates today. We really appreciate your time and all the work that you do, not just in front of the camera, but behind the scenes. Audience, for more information about how you can access this press briefing on various platforms, visit our website at www.victoriatxoem.org. You can also call our COVID-19 hotline at 361-580-5796. Once again, as of 2:30 p.m. today, we had 0 new cases, and we're still at a community count of 89. We will update our website and social media with these new numbers, which is evolving throughout the day, at 5 p.m. today to our county and city Facebook pages. Last reminder is just to, if you have time and while you're at home, to respond to the 2020 census at my2020census.gov. And last, I just want to take the opportunity to thank you in the room, several media agencies, and you, the public, who are viewing consistently our daily briefings, our Monday, Wednesday, Friday briefings, and all of the briefings that we've held. I hear daily about the questions our community members have and concerns about COVID, and that's why we host these, to answer your questions. That's why we set up the COVID hotline, to answer your questions, and that's why we welcome media to come in and help us get that message out. I know that everyone has a lot of questions, and that's what we want to do, is answer them to the best of our ability. Again, thank you for committing to being informed citizens and for helping keep your community just as informed as well. There's wisdom in staying informed about how our city is addressing COVID-19. So thank you. Thank you for your time, and we'll see you same time, same place on Monday.